After talking about the risk factors, the main question people ask is, how do I know I have a breast cancer? So the most common symptom people know of is that you have a tumor or a nodule or a mass, as people commonly call it, in the breast. But there are other signs and symptoms to watch out for. For example, you can have a nipple discharge, you can have a retraction of the nipple, you can have a skin dimpling, you can have redness or increase in size of the breast. All of those things are signs or symptoms of breast cancer. When you have them, it doesn't mean you have a breast cancer, but those are things you need to be on the alert for. Meaning, if you see any of those changes, you need to go to the hospital for a proper examination. When we talk about the symptoms, it's because we want to make sure that patients go early to the hospital. Another means for you to catch breast cancer early is through screening. Screening helps us to diagnose cases before they become very symptomatic, and it saves lives, because once a breast cancer is caught quite early, the chances of survival are very high. Now, there are many screening methods. We have mammographies, which is the gold standard for screening, which is usually done in women from the age of 40, and that should be repeated every 2 years if we have a negative result on the first one. Now, for those who have risk factors like a positive family history of breast cancer, their screening may need to start earlier, maybe from the age of 30, because more and more we have patients who come in their 30s and even 20s with breast cancer. Now, another method of screening for those patients may be breast ultrasound scans, or we can have MRI scans if we find out that the patient has a higher risk of getting breast cancer. Now, the one which all of us should know about, which we can do at home, is self-palpation of the breast. We need to do that every month, at least 1 week after our monthly cycle, to make sure that we check for any new lumps, any changes in the breast.
AFG Bank Cameroon, and everything becomes possible.